Hi, my name is Clara Jones, and the title of my project is A Local Clinic's HCV Screening Rate for Patients Born During the Years 1945 through 1965. Before we get started, I would like to take a second to thank my mentor, Dr. Christopher Jordan, for his guidance during this project. So what is hepatitis C? Hepatitis C is defined as a systemic viral infection that can be acute or chronic, primarily involving the liver, caused by hepatitis C virus, or HCV. It is estimated that 3 million individuals in the United States are currently living with hepatitis C infection, making it the most common bloodborne pathogen in the U.S. Of these 3 million individuals, studies show that 45 to 85% are unaware of the infection. It only takes about 6 months for acute hepatitis C to develop into chronic hepatitis C. And chronic hepatitis C is the #1 cause of chronic liver disease and liver transplants in the United States. On a state level, it is predicted that 38,000 Arkansans are currently infected with the HCV virus. Before 2013, providers screened patients for hepatitis C by utilizing the risk-based screening guidelines. These guidelines are listed on the slide. It is said that screening based on these guidelines is missing 49 to 75% of the hepatitis C infections in the United States. Because of these statistics, the United States Preventive Services Task Force released a statement saying the USPSTF also recommends offering a one-time screening for hepatitis C infections to adults born between 1945 and 1965. These are considered the baby boomers of our time. It is estimated that adding a birth cohort screening will find over 800,000 new cases of a hepatitis C infection. Early detection of hepatitis C could save patients a lot of money in the long run. For example, a 12-week treatment for hepatitis C can range from a one-time cost of $66,000 to $95,000. In contrast, end-stage liver disease costs the patient $4,900 a month, or approximately $60,000 a year indefinitely. The purpose of the study is to compare the screening rates for hepatitis C virus in male and female patients born within the years 1945 to 1965 in the local clinic to the national average hepatitis C screening rate of 12.8% for female and male patients born within the years 1945 to 1965. IRB approval was obtained through Arkansas State University. A retrospective chart review of 100 charts was conducted. Data was collected from a primary care clinic in Paragould, Arkansas. Data included birth year, age, gender, if the patient had been screened for HCV, and if the patient was screened based on risk factors. My inclusion criteria was born during the years 1945 to 1965 and visited the clinic between January 1st, 2019 and May 31st, 2019. Exclusion criteria was born earlier than 1945 or later than 1965, and if a hepatitis panel was performed. Results showed that 44% of the patients that visited the clinic between January 1st, 2019 and May 31st, 2019 were screened for hepatitis C. 40% of those patients were screened based solely on birth cohort. These results greatly exceed the national screening average. Here's just a chart showing how the clinic screened 40% of their patients compared to 12.8% of the national average. Each provider at the clinic also exceeded the national screening average. Provider number 1 screened 28.9%, provider number 2 screened 53.5%, and provider number 3 screened 40.6%, all of which are greatly increased compared to the national screening average of 12.8%. The ultimate goal is to screen 100% of baby boomers. This would allow us to detect hepatitis C infections in the earlier stages and start appropriate courses of treatment. In return, this will decrease the amount of end-stage liver disease and liver transplants due to hepatitis C infections. After discussing the results with the providers, we concluded that best practice alerts improve hepatitis C screening rates in the 1945 to 1965 birth cohort. We also discussed further education to solidify provider knowledge of hepatitis C. This further education will create a confidence when discussing why a patient needs HCV testing, instead of just saying it is recommended. I would like to thank you all for taking the time to listen to my project. I hope I have provided insight into the importance of birth cohort screening along with risk-based screening for hepatitis C. Again, thank you for your time.